Good afternoon, everybody. We are just waiting for folks to be admitted into the room, and we'll get started in just a couple of minutes. But just as a introduction, this is the Preparing for a Career in the Health Professions webinar. I'm Charlie Scruggs, and I will be one of the presenters today. And we are excited that you're here to learn a little bit more about health professions at UCR. So again, we'll just get started in a minute or so. We'll just wait as other guests continue to come in the room, and we'll get started in just a moment. All right, again, welcome if you're just joining us. This is the Preparing for a Career in the Health Professions webinar. My name is Charlie Scruggs, and I'm the Director of the Health Professions Advising Center at UCR. And I'm joined with my colleagues this afternoon, Amber Nicholson, who is our Assistant Director of the Pre-Professional Advising Center, and our colleague, Erin Hurd, who is a Senior Admissions Coordinator at UCR School of Medicine. So again, we're excited that you're joining us this afternoon. Just a couple of housekeeping pieces of information. Again, this session is being recorded. We will have this session posted with the UCR Office of Admission, so that will be coming up in the near future. We will also have it posted on our website with the Health Professions Advising Center. We'll make sure that you have those resources before we wrap up today. But again, the session is being recorded. We also will be doing question and answer through the Q&A function, not the chat function. So you may see some links that are being pushed out to you with information through the chat box, but we'll actually have time for Q&A through the Q&A box. So we will make sure that we want to receive your questions there so that we can share that information with all of you through this webinar. So again, we're excited to have you, and we're going to go ahead and get started talking a little bit about health professions at the University of California, Riverside. All right, so the Health Professions Advising Center, our mission is to provide information, pre-health advising and support for students that are interested in graduate and professional programs in the health professions. So as our name indicates, the Health Professions Advising Center, we spend a lot of time with students educating them on health professions careers. We talk about coursework, prerequisite courses that are needed for that health professions. We talk about experiential learning, high impact practices such as shadowing a health provider, getting volunteer experience, community service, research, leadership, all these things that we want students to experience during their undergraduate career, as well as for them to have that experience to find out if health professions and going into healthcare is something that's of interest to them. We also spend a lot of time working with students through the application process, and we'll talk a little bit about that this afternoon. It's application season for us right now in the spring, so this is something that we are actively doing with our current students and does take quite a bit of work. That's a big part of what our office does in supporting students who have interest in furthering their education in the health professions. So I wanted to talk a little bit about our population. At UCR, we have students that are interested in a variety of different health professions that span across any academic level. And what I mean by that is students at UCR are pursuing a bachelor's degree, either a Bachelor of Arts or a Bachelor of Science. And they may be interested in a health professions career after UCR that may involve getting a certificate. So think about being an EMT or a paramedic. Some of our students are interested in health professions careers that require an associate's degree. That may be in the areas of like being a respiratory therapist or a dental hygienist, a physical therapy assistant. Another bachelor's degree program that could be in nursing, master's program, speech language pathology, PA is very popular, occupational therapy, and then doctoral and professional schools. So doctoral programs, physical therapy, audiology, and then our professional programs, medicine, dentistry, pharmacy, veterinary medicine, podiatry, and so forth. So there's a lot of different health careers. There's over 100, and we'll talk a little bit about that. So working with our students to identify those, we work with students from their freshman year all the way through being an alumnus. So some of our students have graduated from the university, they've come back, they want to talk about health professions, so we'll still meet with them. Our students are from all of our undergraduate colleges and schools in a variety of different majors. So we work with them, whether they're a STEM major or they're pursuing social sciences or humanities or engineering or education, and there is no additional fee to utilize our services. We also don't require students to complete an application to use our office. So it's not a membership, and it's an advising center. It's not a club. At UCR, we do not provide a pre-health minor or certificate. You may have been looking at various colleges and universities around the country that do that. I will say, even though we don't do that, that doesn't lessen the chances or disenfranchise our students for getting into health professions programs. Our office is open year-round, so we serve students during the traditional academic year of fall, winter, and spring, but we're also very much available during the summer. And one of the really cool things about our office is we work with a lot of students. And so at UCR, our pre-health community is roughly around 5,000 students. And again, that runs the gamut from our freshmen all the way up to alumni and our students in STEM and non-STEM majors. So our students are, as I said, interested in a variety of different health professions. Medicine is probably our most popular. Some of that is because that's what students know. They know about the field of medicine. We have a medical school that you'll hear about from Aaron Hurd during this presentation, but pre-med seems to be very popular at UCR. And so we work with students to talk a little bit about MD or allopathic medicine, osteopathic medicine, podiatry. We also have students interested in dentistry, pharmacy, optometry, physical therapy, occupational therapy, a lot of other allied health professions as well. So we're working with students, we're talking about those professions, we're talking about what's involved. As I mentioned earlier, we're talking about getting involved in clinical experiences. So this tends to be, this is not an exhaustive or final list, because as I shared, there are over 100 different health professions, but this seems to be some of the more popular that our students are interested in at UCR. You'll see that we have an asterisk, and we also have nursing highlighted in red. The reason for that is because we do not have a nursing program at UCR, and that's really important for you to know. We do not offer an associate's or a bachelor's degree or a master's degree in that field. So if that's something that you're interested in, we do want you to look at colleges and universities that do provide that. However, we do have students through getting those clinical experiences and through their own development and research into careers decide that they want to go into the field of nursing. So we still support those students. We do provide advising for them. We help them identify clinical experiences and courses that they will need. But one of the things that I think it's important to note is that we don't offer a lot of prerequisite coursework for students that are interested in nursing programs. So generally what that does is that adds coursework that they would have to take either in the summer or post UCR at another college, whether it be a community college or another four-year institution. And then in addition to that, it does add expense. So again, if nursing is something that you're interested in, just note that we do not have a nursing program at UCR, and we do not offer all of the prerequisites that would be needed to enter a nursing program. So I wanted to talk a little bit about our services. If you think about the pillars that hold our office together, I would describe them as four. So as our name suggests, we do academic or pre-health advising. And so pre-health advising is one of the main things that we do, and we do that every day. And that generally comes in the form of a 30-minute or a 60-minute appointment. We also have a peer mentoring group in our office. We have 16 peer mentors this year. We also refer to them as ambassadors. They're juniors and seniors. They're very involved on campus. They have taken a majority of the prerequisite coursework. They've shadowed health providers. They've volunteered in hospitals, nursing homes, hospice centers, assisted living centers. They have been very involved in the community through community service. So our advisors provide the professional point of view and our peer mentors provide the student point of view, which is really great. You're getting both sides there. Additionally, we offer a wide portfolio of workshops and events and career panels every quarter. And in addition to that, we have a lot of information on our website and several social media platforms and a YouTube channel where we are frequently posting information about events, about careers, things that are going on. So we do encourage our students to, in addition to working with advisors and peer mentors, to participate in social media and in workshops and events so that they're continuing learning about health professions fields and the things that are going on in the health professions world. We also, as I shared earlier, we do a lot of application support. We do personal statement, mock interviews. So anything that really involves preparing students for health professions fields, those things do come through our office. This is just a little bit of information about our 16 ambassadors that we have this year. So fantastic group. We rely on them for the student point of view. And you'll see on the right-hand side there, that's a snapshot of their drop-in hours. So one of the really great things about our ambassadors is that students do not have to schedule an appointment to meet with an ambassador. They do for an advisor, but as an ambassador, it's drop-in, and we do drop-in hours Monday through Friday from 10 a.m. to 5 p.m. And we do this fall, winter, and spring. And then in the summer, they would meet with an advisor, but you'll see it's very easy for students to hop on, talk with an ambassador. If you go to our website, you can actually view our ambassadors, their profile, a little bit of information about their major, their class standing, and some of the events that they're either currently involved in or have previously been involved in. This is a snapshot of what our quarterly workshops look like. It says fall because this is a sample of some of the workshops that we would be offering this coming fall. You'll also see in our chat that we have a link to our current workshops that are going on this spring. But one of the workshops that I wanted to point out is our Introduction to Health Professions workshop. That is covering the A to Z. It's a 60-minute workshop that we offer many times throughout the academic year. And this is something that we want students to attend. It covers the basics of what it's like to be a pre-health student, the prerequisites. We talk about AP credit. We talk about International Baccalaureate credit. We talk about what happens if you have to retake a class. We talk about the importance of getting shadowing, getting community service, getting research experience. We talk about the timeline, contextualizing all of this and what that looks like, and then next steps. So again, this is our Intro to Health Professions workshop, and we actually do require students to attend this before they meet with an advisor in our office. We also have this recorded. We put it on our YouTube channel. So this information is very easy to access. And oftentimes students will go back and watch this workshop if it's been a while, just so they are up to date and reminded of the things that they should be doing as a future applicant to a health professions program, as well as remembering the timeline that they would follow. And you'll see additionally other workshops that we offer for students. And again, these change every quarter, fall, winter, spring, and summer. We offer workshops through our office. In terms of what's the best major, that really is up to the individual student. You do not have to be a science major or a STEM major to go into a health professions field. Health professions programs across the gamut from medicine, dentistry, pharmacy to allied health accept students in a variety of different majors. What you will need is a list or a list of life science core prerequisite classes. And that's something, again, we'll post in the chat, that you will see the courses that students at UCR are taking. And this usually covers the areas of calculus, statistics, general chemistry, biology, organic chemistry, physics, and biochemistry. And there may be additional courses that are required as well. It really depends on the health professions program. Something like PA school or pharmacy school or veterinary school requires actually a significant amount more of prerequisites than somebody maybe going to medical school, believe it or not. So we make sure that students have that information very early on. They're building it into their major if it's not already built into their major, and they know how to move forward. We also talk a lot about the GPA, the cumulative GPA, and how that's important, and that there's a science GPA and a non-science GPA. We also talk a lot about the standardized exam, which generally happens around the time that the student applies, which may be in the end of their junior year or into their senior year. And so that information also comes from our office. But again, we want you to choose a major that feels good to you, that's right, that you're excited about. If it's a STEM major, that's great. A lot of the science classes will be built in. But if it's a humanities or social science or education or engineering, we will work with you. The key is very early on, hopefully, that you'll be able to build in those additional courses, that at the time of graduation, you'll be ready to have your coursework done and moving on toward the application of the health professions field that you're interested in. We think it's really important to share with you some of the national data that's out there regarding applicants for the health professions. We don't share this to intimidate you, but in our office, we collect data. Amber, who I introduced earlier, our assistant director, this is one of the things that she really enjoys, is going through and sifting through the data. And we look at this every year in terms of the national data and the data of the students at UCR. So what I'll say with this is that you'll see that there are, as I mentioned before, 2 GPAs. Health professions programs generally look at the cumulative GPA as well as the science GPA, the science courses being in biology, chemistry, and physics and mathematics. I'll also share that when students come to UCR and work with our office, we are engaging them to think nationally. So they may want to apply to medical school at UCR or in Southern California or in California in general. But we are going to also encourage them to think outside of the state. California is one of the most impacted states, and we have a lot of applicants that are interested in the health professions. So we want to make sure that our students are thinking broadly and being prepared to apply to the schools of their choice, and that may be in-state, but out of state as well. So you'll see here that our students are going across the map. And if you click onto our website, we actually have it broken down by health profession and by school. And you can take a further look to see where students have went in various health professions programs. We think it's really important that as you are continuing in your studies in high school and preparing for college, that you continue to work really hard, that you establish a really good record. So you're finishing up high school, you're getting ready to come into college. We want you to be really excited about your future and making choices that you're happy with. We want you right now, even if you're in high school, to start doing some research into health professions careers. Prior to the pandemic, we were encouraging students to be shadowing, to be volunteering. Most volunteer programs require you to be 16, but we realized that we are through, hopefully, our global pandemic, and that this summer or early fall, you'll be able to start being engaged if you're not in a health professions environment. So you will figure out if this is something that's right for you. Get involved in student organizations. There are over 500 student organizations at UCR. Of those 500, there are roughly 40 that are pre-health focused. Pay attention to things that are going on in the news, global health debates. Again, we're in this pandemic, that's really hard to miss, but also other things, other health issues, physical health, mental health, emotional health. As a future health provider, you're going to be exposed and stepping into people's lives, and you need to be ready for that. You need to understand what that looks like. And even though you may not be in medical school or dental school now, or have some of those higher level science classes, you still are able to shadow, to get into some sort of volunteer experience, to have some exposure to that. And as you're doing those things, reflecting on your experiences, reflecting on what it's like to be in a science class, what it's like to be out shadowing or volunteering, so that that's helping you figure out your plans moving forward. Our office, again, we're the Health Professions Advising Center, and I wanted to share here our website, hpac.ucr.edu, again, coming through the chat. So you are welcome to take a look at our website. We have a lot of career information on there, as well as support services that we provide our students. And when we do return back to campus, we are located on the ground floor of Rivera Library. That's the building that has the mid-century arches. We're located there, and we're happy to see you if you decide to attend UCR. So with that, I am going to pass it over to my colleague, Erin, who is at UCR School of Medicine, and she is going to talk about the Thomas Haider Early Assurance Program, as well as the Thomas Haider Traditional Program. So Erin, I'm going to go ahead and pass it on to you.
Thank you, Charlie. Hi, everyone. My name is Erin Hurd. I'm the Senior Admissions Coordinator at UC Riverside School of Medicine. So typically when I conduct these presentations, I like to give you a little bit of history on the School of Medicine, but we're a little short on time. So what I'm going to do now is just give you the School of Medicine's mission, and then I'll provide you a few of the pathways to medical school. If it's something that I don't touch on, feel free to use the chat to ask questions, or I will answer your questions at the end of the chat. I will also give you my contact information if you'd like to contact me directly. So the UCR School of Medicine is a regional community-based school with a social mission. So our mission is to expand and diversify physician workforce in inland Southern California, produce doctors who are going to go into the medical fields, particularly primary care, also produce doctors who are trained for the future. So doctors who are going to establish more innovation in the medical field, preventative care, and health education. And overall, we really want to improve the health of this community. The Inland Empire is undersupplied with physicians. We need more physicians and more established medical care here. So what we'd like to do is seek mission fit students who are going to support this community through the completion of residency programs and becoming a local physician in this community. All right, so the pathway to education, to medical school, begins in graduate years. So that's typically the time that you'll want to complete your prerequisites before entering medical school. So while we do get some non-traditional students who may not necessarily know that they want to be a physician and maybe start that later in life, there are people who know very early on that they want to be physicians. So typically what we suggest is that you start as early as possible. Start your getting that those prerequisites completed. Start getting that extracurricular, clinical, community service experience completed. Utilize HPAC, all of these resources that are going to help guide you on your path to becoming a physician. As Charlie mentioned, we do accept all majors, so you don't have to be a natural science major in order to apply to the School of Medicine. And honestly, it's nice to have like a diverse background of students. It's great to have someone who maybe majored in a social science or majored in art, but can still provide that perspective as a physician. So what we would suggest is do whatever you enjoy, what you're passionate about, complete the prereqs, and then you can apply, and then you can be a physician and still have the full robust education that you intended to have as an undergraduate student. So you're going to be dedicating 4 years to your undergraduate studies, and then you'll enter medical school where you'll have the 4-year program at the School of Medicine, and then you'll go on to complete your residency, which will last between 3 and 7 years, depending on your specialty. So for someone who knows very early on, I want to become a physician, this is going to be a lot of time dedicated to those years leading up to practicing medicine. So the earlier you start, the more of a leg up you can get on preparing to be a doctor and supporting our community. Okay, so there's 2 particular pathways to the UCR School of Medicine. The first that I'm going to discuss is the Early Assurance Program. This is our premier program, and it's available exclusively to all UCR undergraduate students. The great thing about this program is you as a student can apply beginning your junior year, or you can apply as late as 1 year post-grad. So it really just depends on when you feel that you're ready. So you will be taking this time to assess your academic preparedness, meeting with HPAC, determining when you're ready to apply to this program, so you can make sure that you can, display the best version of yourself as an applicant. You can only apply to the Early Assurance Program one time. So that's why I say utilizing all of your resources just to making sure that you're ready and prepared. So if you apply as a junior, you feel like this is the best opportunity for you. If you choose to apply as a senior, you know that that was the best opportunity for you as well. So overall, our goal is to get the most mission fit students to apply to and enroll in the medical program as early as possible. So this program is great because it allows you to apply as a junior versus the regular medical school, where if you're applying to the regular medical program, you will likely be applying during your senior year. So you'll have that opportunity to apply as a junior, possibly get all of that those nervous jitters about applying to medical school out of the way if you're admitted. And then from there, you can use your senior year to do research or continue your community service. And you wouldn't have to worry so much about am I going to get into medical school? So we have a maximum of 10 seats for this program. So overall, we accept 24 UCR students to the School of Medicine. 10 of these seats come from the Early Assurance Program. So students would apply to the Early Assurance Program, and then from there, we would fill those 10 seats, and the remaining seats would be left to regular UCR applicants who would apply through AMCAS. So I'm just going to go over some of the admissions requirements now. So in order to be eligible for the Early Assurance Program, students must attend at least 4 consecutive quarters at UCR as an undergrad. So you also need to have a CUME BCPM GPA of a 3.4. So BCPM are your biology, chemistry, physics, and math courses, math including calculus and statistics. As an applicant, you should also want to focus on dedicating your time to extracurricular activities, including community service, gaining clinical exposure, particularly with the underserved community, and just making sure that you have all of that additional knowledge and preparation before you apply. One of the great things about the Early Assurance Program, which is why I think a lot of students target it, is that the MCAT is not required. Typically, when an applicant applies to medical school, you would submit your medical college admissions test, which is your MCAT score. We do not require that score. So your application is being assessed very strongly on your academics, as well as any clinical community service and additional extracurriculars that you complete up to that point. So it's very important that you perform well in your prerequisite coursework if you're applying to this program. It's very competitive. We also look at leadership experience. We look at overall character traits. This is a brief presentation, so unfortunately, I don't have the time to really go into that. But what I would suggest is that you view the recording of, there's an info session that took place with the Dean of Student Affairs last year. It's on our website, and I believe HPAC also has that listed on their social media. She really did go in depth about the medical admissions process and what the admissions committee looks for in our applicants. So I would suggest that if you want a little bit more in-depth information on that, that you review that presentation. So the early assurance program has a separate admission cycle from the regular Haider program. So right now we're actually in the middle of that cycle now. So the application opens in December and then it closes April 1st. And so what we do is we spend this time reviewing the applications. There's also an interview involved. And so from there, we would either admit a student or we would reject them, but that would allow them the opportunity to know that they are ready to apply to the Haider program. That also gives them the opportunity to make sure that they take the MCAT, because the MCAT, while it's not required for early assurance, it is required for the regular admission cycle. So if you're applying to the regular Thomas Haider program through AMCAS, you must submit an MCAT score. So the regular Thomas Haider program, it still continues in the tradition of providing a unique pathway to medical school for UCR students. This is because when you're typically applying as an outside applicant, you're applying from colleges from all over the world. We get an average of about just under 6,000 applications to our regular medical program. This year, we're just under 7,000. So you're competing with a lot of other students for a seat at the School of Medicine. For these 24 seats, you're only competing with other UCR undergraduate students. So you have a more viable chance in being accepted to the program. And you actually have two opportunities, because you can apply to the early assurance program free of charge. And if you're not admitted, then you have a second opportunity to apply through the regular Thomas Haider program. So it just really depends on what's best for you. We suggest that the more highly academic applicants apply to the early assurance program. However, if you feel that you are a strong applicant and you want to take that chance by not having to complete the MCAT and just seeing what your chances are of getting admitted to the program, then I would suggest that you apply. From there, you would see if you're admitted or not, and then the AMCAS application will open shortly after that, and you'll have enough time to apply as well as take the MCAT so you can submit your score for the next stage. There's also supporting documents that are required. So we require letters of recommendation. There's a minimum of 3 letters, maximum of 5. We also require, as I mentioned, extracurriculars are very important for medical school. So we do require community service, clinical experience. Applicants cannot, you won't have a viable chance of getting into medical school without these things. There's also other avenues that you can take to beef up your application by doing some research. We don't weigh too heavily on research, but if it's something that you're interested in, a particular research project, then we would encourage you to do that. Also participate in symposiums. There's so many different things that you can do. And I'm sure HPAC, once you become a freshman student, you can meet with someone in HPAC and kind of get some more of this information. Also check their website. Our website is also available as well, where you can access this information. So one of the unique pathways to medical school that I would strongly suggest that you look into is the pipeline program. So the pipeline programs is part of the School of Medicine, And they have several programs that are geared towards high school and college graduate, up to college graduate students who want to go into careers in medicine and the healthcare field. So they have these many programs that you can apply to, participate in, and use some of that experience towards your preparation for your medical school application. So these are some of the programs here. I've also included their website as well as the email of the Pipeline Programs Director, Teresa Cofield. You are welcome to view their website for additional information on these programs. However, I did want to take a moment to just kind of highlight a few programs that are coming up currently for pipeline programs. And if you're interested in applying, then I would suggest that you take the opportunity to apply since these programs will be occurring this summer and this fall. So the first program is the Future Physician Leaders Program. It's a 9-week summer program for pre-health students who want to fulfill a mission in service to this community. So you can apply as a current junior in high school up to being a recent college graduate. So that application is live right now. The deadline is April 28th. So if you're interested in applying, now would be the time to do that. Also check for more additional details about the program on Pipeline Programs website. Just so if you want to know a little bit more about what that program is about, you can get a little more information on it just to determine whether or not it's right for you. Another program that's coming up is the Jumpstart program, and it's a 1-week program for new UCR freshmen pursuing health careers. So this is taking place for 1 week in the fall. The application will open May 1st. So if you're interested in applying, especially as a first-generation college student, first-generation medical student, someone from a socioeconomical disadvantaged population, and you really want that support that's going to help guide you to get into medical school, the pipeline programs are the best programs to just help support and prepare you for everything that you need to become a medical student. So Jumpstart program is one that's coming up for UCR freshmen. If you're a entering freshman, I would suggest that you look into applying to this program. I think it would be a great opportunity for you to just kick off your path to becoming a physician. And lastly, I want to promote the open house. So every year, the School of Medicine has an open house in April. And typically this would be an on-campus event where you would be able to come and see the facilities. We have a closed facility, so we normally are not open to the public, but during open house, it's the one time in the year that we allow applicants to enter and see more of the building and meet more of our students and just learn more about the program. So this year, due to COVID, the program is online. However, it's going to be taking place over the course of 3 days. So you'll have 3 opportunities to learn more about the School of Medicine. There's a curriculum overview as well as a medical student panel. We have simulation and clinical skills presentations. And on Thursday, April 15th, Pipeline Programs, they're featuring a presentation for the future physician leaders as well as the mini medical schools. So these are 2 of those pipeline programs that I mentioned. So if you want to learn more about what those students do, the type of projects that they're working on, being a part of these, this is a great, that is a great event to attend. So the link is here on the page. If you'd like to register for that program, then please do. Also, I'm just going to wrap up now by providing my contact information. Here is the number to the Office of Admissions. We are not in the office right now. We're actually all working remotely. So you can still call that number and you can get one of our admissions staff if you have any questions. You can also email me directly. I provided my personal email here. When we're back on campus, this is where I'm located. I'm located in the School of Medicine building, room 1682. So once we're back on campus and everyone is allowed to enter the facilities, then you will be able to find me there as well. Also some website info here. So we have some the website for the medical school admission. So if you have any more questions about the prerequisites, oh my gosh. So I just learned that I accidentally skipped a page. So the prerequisites, that's a key page. So I just wanted to I know we're short on time, but I do want to talk a little bit about the prerequisites because it looks like I skipped that page. So we require 8 semester hours of biology, chemistry, and physics, and 16 semester hours of chemistry. So those classes are the prerequisite classes that we require for admission to the program. So if you're a science major, you're going to capture many of those classes in your undergraduate years. If you are a non-science major, then you want to make sure that you're completing the right classes to fulfill those requirements. So those are the programs that, and let me see if I can just. So there's the page. So I know a lot of people are visual, so I just wanted to show the page to you. So these are the prerequisites that we require. There's also recommended humanities courses, English, humanities, as well as Spanish. We have a large Spanish-speaking population in Inland Empire and in California as a whole. So it is very helpful to have some Spanish coursework completed so you can effectively support your patient population once you become a physician. So we also now accept AP credit. So if you are entering college with AP credit, you can submit those scores for those prerequisite courses in support of your prerequisites and your application. Those credits must be, however, listed on your application. So please make sure that those credits are on, not your application, I'm sorry, your transcript. So please make sure that those are listed on your transcript. If they're not on your transcript and UCR does not acknowledge them, we will not accept them. So that's it for this presentation. I'm so sorry I skipped that page, but this is a very crucial part of your preparation for medical school education. So I did want to make sure I went over that really quickly. So now I just want to open the floor for questions so I can answer and support you in whatever questions you have.
Thank you, Erin. We've gotten through quite a few questions in the Q&A feature, but there are more. I'm going to go ahead and give you a talking break for just a second, and I'm going to give the first 2 questions over to Charlie, and then we'll wrap back around with some more School of Medicine related questions. So Charlie, if you could do 2 things for me. If you can go over the UCR, or excuse me, the pre-medicine prerequisites in quarter units, that would be helpful. And if you can also address what is the quote unquote best major for medical school. If you can address those 2 questions, please.
Okay. All right, great. Thank you, Amber. So I'll do the second question first. What is the best major for medical school? It really just depends on you as the student. Medical schools are very open, as well as other health professions programs, to different majors, whether they're STEM or engineering or social sciences like psychology, sociology, economics, or humanities, philosophy, a foreign language. So we want you to choose a major that you're going to be happy with and that you're going to do well in. The second part of that is if it's a non-science major, then you will be working with an advisor in your major, as well as an advisor in our office, to identify the pre-health courses that are needed for that health profession's career. So let's say that you are a sociology major and you have been admitted to the College of Humanities, Arts, and Social Sciences. You'll have a sociology major, and that person will be meeting with you, or you'll be meeting with them to make sure that you're meeting degree requirements to get that BA, that Bachelor of Arts in Sociology. And then you'll also tell them, I'm interested in becoming a physician or a dentist. And they'll refer you to our office, and we'll sit down and we'll review those requirements, and we'll make sure that you know those classes, and we're going to see that you can fit them in during your undergraduate career. So for some students, it's a lot easier if you're coming in your freshman year for us to have that conversation. If you wait until your junior year, it's going to be a more challenging conversation because you're going to be sweating trying to get this done very quickly. So the earlier, the better. The first question that I'll answer last is regarding quarter requirement. So yes, UCR is a quarter school. Like most UC schools were on quarters, but most of the country, those colleges and universities are on semesters. So we're going to make sure when we're looking at course requirements where it says a year of biology or maybe 3 semester hours or 4 semester hours, we're going to compare that to our courses to make sure that you're meeting the requirement. Generally speaking, 2 semesters of biology or 2 semesters of chemistry equal 3/4 of biology at UCR, 3/4 of chemistry. So we're just going to make sure that you're meeting those degree requirements. And if there are additional courses, let's say that you want to go to pharmacy school and you're looking at pharmacy schools and you're seeing that maybe they're requiring 5 credit hours, 5 semester hours of biochemistry, then we're going to look to see that you get that course at UCR, which is Biochem 100, but we also will do a further check to see if you have to have 2 biochem courses. So again, there's over 100 different health careers, so it's very hard to, in this limited amount of time, parse that out. But once you know, you'll come in and we'll meet and we'll review the requirements at the schools that you're looking at, or just generally for the health profession that you're interested in. So I hope that's helpful.
Thank you, Charlie. So we're going to move over to a couple questions for Aaron. I'm going to give you 2 questions to consider responding to. The first is about the pipeline programs in the summer with Fast Start and FPL. A couple people wanted to know if that was going to be in person or virtual. And then the second question that's come up a lot is some data. So a lot of people want to know how many people are applying to Haider versus getting accepted, how many people are applying to EAP, getting accepted, and what are the average metrics of the students accepted to those programs?
Yeah, so just due to the CDC guidelines, we're not able to hold large group events on campus just yet. So all pipeline program events will be online. So that's the answer to the question. They're online. And then the second question you asked about the metrics for acceptance to the insurance program. Well, I can tell you for this year. So this year we had over 100 people start the application. However, only about 80 of those students were eligible to apply. And so eligibility is through actually submitting all documents that are required for the review. So we require letters of recommendation, we require submission of their transcripts so we can assess their academic preparedness. And then of course you need to complete and submit the application. So of that, we have right now about 80 applicants that we'll be reviewing. It changes year to year. I noticed that the program is getting a lot more popular. So because of that, you know, the application load is increasing every year. We interview, this year we're going to interview about 20. So we're going to narrow down that 80 to 20 who will interview. And then from there, we will make our selection of the 10 applicants who will be admitted to the early assurance program. So those 10 seats are part of the 24. So from there, there will be about 14 seats remaining where when you're applying to the regular Thomas Haider program as a UCR student, we maybe get 200 to 300 applications a year. So we're narrowing it down from that amount.
Okay, thank you. Another question came in about the pipeline programs with FPL. Are there any regional considerations where somebody may have priority to be admitted or not be able to complete the program because perhaps they're in the Bay Area and not locally, and or do you preferentially admit people to FPL that are from inland Southern California? So 2 kind of slightly different FPL questions.
So typically the short answer is yes. We want people who are a part of this community who plan to continue to live here and practice medicine here once they've completed medical school. So the idea would be to recruit local applicants. But I wouldn't say that you wouldn't have a chance of applying to the program. I would suggest that you contact the Pipeline Programs Office directly. Unfortunately, I don't work for Pipeline. I work for admissions to the School of Medicine. So I more so have answers to the medical school questions. If you have questions for Pipeline, then they will be able to give you a better idea of what your chances are, or even if it's worth your while to apply.
Okay, some more questions, Erin, about EAP. So students are wanting to know when they apply, how they apply, and if it's binding. Let's start with those three questions.
Yeah, so the EAP application typically opens in December. So December 1st is when it usually opens. It could change year to year. We opened it in January this year, but it typically opens in December, and an applicant has a roughly 4 months to complete their application and submit the supporting documents. The application closes on April 1st. And then from there, we spend the next month reviewing the applications. So once we're done reviewing applications, the committee will then select the applicants invited to interview. We do hold typically the MMI interviews, which are interviews where they're usually in person. This year, we did them virtually for the regular application cycle. Sometimes with early assurance, it could be panel style, but we're probably likely going to continue to revert to the MMI interviews. So you'll interview and be assessed on how you answer the questions, your maturity, your ethics. It's a series of questions that revolve how you will react in certain real world scenarios. So if you're a physician and you are put in a circumstance where you might be dealing with a difficult patient, or you would want to know how to advise someone. Also, even situations that you could be put in as a student, someone cheating, or just someone who maybe you're put in a tough situation where you have to make the right decision. So it's a variety of interview topics that could come up. And then from there, we do admit the class. And then you would know by May, the end of May, if you are admitted to the early assurance program. If not, then you will have the opportunity to apply to the regular Thomas Haider program. Did I miss something? I just want to make sure.
No, I think you addressed all of the questions I asked. So the next one's for Charlie. I'm going to give you a break, Erin. So Charlie, if you can please speak to when or how early a student should start engaging in clinical experiences, as well as what types of clinical experiences do freshmen generally engage in once at UC Riverside?
That's a great question, Amber. So in terms of when, now is really the time. Again, given the pandemic, that may not be as easy as it has been traditionally. But if you think that you're interested in pursuing a career in the health professions, I would encourage you to start thinking about shadowing a health provider, whether it's your own family physician or dentist or optometrist, or even maybe volunteering at a skilled nursing facility like a nursing home or an assisted living facility or a hospice facility. It's really important for a couple of reasons. First of all, if you decide that you want to go into, let's say, nursing, again, as I shared, we don't offer that at UCR. And so if you know that's something that's right for you, probably want to get that experience, and that may now, so that will allow you to make the decision that's right for you in the fall of where you want to go to school. If you're thinking generally or broadly about health professions, though, it's still, or now is still the right time. We really don't want you to wait until you get into your freshman year or sophomore year or later in college, because you're going to be really busy. You're going to be transitioning from being away from home or commuting or from high school to college work, and being in courses and labs and social organizations, and trying to figure out your career added onto that very early on can be somewhat challenging. And so I think getting that idea now, having that experience now is really important. In terms of where, so I mentioned, your own health provider, shadowing them, or if you're not able to do that right now due to the pandemic, maybe contacting them to see if they could do like a Zoom lunch or coffee meetup, something where you're able to have some FaceTime with them and you're able to just ask them general questions like, how did they know they were interested in that field? What are some of the experiences they got? What are some of the things that they thought about that? Was that a, yes, affirming things are really challenging, but I want to do that with my life? Or was there a high stress about something that they experienced and they decided that's not right for me? So having that FaceTime now is really important. I will say for our undergraduate students, most of them are not EMTs, some of them are, or they're not certified nursing assistants, some of them are, or not dental hygienist or assistants, some of them are. But shadowing, volunteering at a hospital, volunteering in a clinic, those are great ways that don't really cost you money for an additional certification. And generally, as a volunteer, you're not signing up for 10 hours or 20 hours a week. It's usually a couple of hours a week or every other week for you to be introduced to that career. So I think now is really important for you to gauge your interest. So it's going to help you figure out what you want to do forward, maybe school selection, and then also course selection as well.
Thank you, Charlie. So we have time for one last question. It's for Aaron. And if you could speak to the increased size of the UCR School of Medicine class size and how that will or will not impact the 24 seats reserved for the Thomas Haider program.
Well, that might be a question that's a bit above my head. I know in the future we would like to offer more seats to the School of Medicine, but there's so much involved in that, funding, space. We have a new building that we'll be launching in the next couple of years. We've outgrown our current medical building, so we'll have a larger building, larger facilities just for our students as well as our staff. So as we continue to grow, we would like to offer more seats. I don't think that will affect the 24 seats. If anything, we would love to one day increase those seats available to UCR students. It's just a process where unfortunately I wouldn't really be able to offer much more into that. But like I said, as the School of Medicine continues to grow, those 24 seats will be standard. So they're not going to reduce in any way.
Thank you so much, Aaron. So I'll try to answer just the last couple questions here in the chat, but I think that was everything pertinent to the group as a whole, which is awesome because we're right on time. So I'll turn the mic back over to Charlie for any last minute words as we exit our session today.
Awesome. Thank you so much, Amber, for helping with the presentation and taking care of the chat. And thank you, Aaron, for your participation and talking about the School of Medicine. Thank you to all of our guests. I posted the link for the Health Professions Advising Center and the link for UCR School of Medicine. Thank you for joining this afternoon's session. Again, it will be recorded and placed on the UCR Office of Admissions website, and it will also be placed on the Health Professions Advising Center's YouTube channel, and you can find that off of our website. So again, thank you for your interest. This was a great session. We hope you learned a lot from it, and we hope to see you this coming fall at UCR. Take care of yourself and have a good evening.
Thank you.